What is conjunctivitis? Conjunctivitis, or pink eye, is an inflammation or infection of the conjunctiva, or the transparent membrane, which lines your eyeball. When the blood vessels located in the conjunctiva become inflamed, they become more visible, giving your eye the pinkish red look. Now, what are the causes of conjunctivitis? The most common causes of conjunctivitis include viruses, bacteria, and allergies. The viral and bacterial forms of conjunctivitis are extremely contagious and can spread very rapidly. Other causes may include a foreign substance in the eye or a chemical getting into your eye. Conjunctivitis is also very common in newborns, and it occurs in newborns when one of their tear ducts gets blocked. What are the symptoms of conjunctivitis? It's very easy to tell when you have pink eye because you can just look in a mirror and see the visible redness there in your eye. If you have pink eye, you may also experience itchiness in your eye. Now, you may also have a very gritty feeling, which means that your eyes will feel very rough and sandy. Now, excessive tearing is also very common. You may also have a discharge in one or both of your eyes that forms a crust around your eye that prevents you from being able to open your eye. Some of the treatments for conjunctivitis. The treatment of conjunctivitis is heavily based on the symptoms you are experiencing. If your symptom is excessive tearing, then your doctor may recommend artificial tears. Your doctor may also recommend cleansing your eyes with a wet cloth or applying a hot or cold compress several times a day. If you wear contact lenses, you'll be advised to stop wearing them because they may be the source of the pink eye and you don't want to reinfect your eye or just make your condition worse. In most cases, antibiotic drops won't be necessary because conjunctivitis is usually viral. The antibiotics may even cause harm by reducing their effectiveness the next time they're used. Instead, the virus will need to take up to 2 to 3 weeks to run its course. And if the pink eye is caused by an allergy, then your doctor may prescribe one of many different types of eye drops. These eye drops may include medications such as antihistamines and mast cell stabilizers, or drugs that help control inflammation such as anti-inflammatory drops and decongestants. Now, what is the prognosis of conjunctivitis? Most patients who experienced allergic conjunctivitis recovered very well. However, they may experience seasonal periods where their condition worsens. If one has bacterial conjunctivitis, then they must take 1 to 2 days of antibiotic treatment and let the pink eye flush out of their system before they can return to school or work because they don't want to infect anyone. Bacterial conjunctivitis generally takes 5 to 10 days to fully heal, and there will be no long-term complications with it. Those who experience viral conjunctivitis are advised to take at least 1 week out of school or work to let the virus take its course and leave the body. Most patients who experience viral conjunctivitis recovered after 1 week and do not have any further complications. Non-infectious conjunctivitis is the least common form of conjunctivitis, and the majority of people who experience this recover well after discontinuation of the cause. The body systems affected by conjunctivitis. One body system that conjunctivitis affects is the digestive system. When conjunctivitis gets serious, it causes people to not have an appetite. This affects the digestive system's ability to produce energy for the body because there is no food for the digestive system to turn into energy. Now, when this happens, people start to feel very sluggish and very lethargic. Another body system affected by conjunctivitis is the integumentary system. Now, skin is a part of that integumentary system, and when conjunctivitis gets out of hand, the skin around the eyes becomes very red, inflamed, irritated, and swollen. What are the statistics of conjunctivitis? Now, the graph above here shows that conjunctivitis is very common in children. This is because children are always in close quarters with each other, and most of the time they have viral or bacterial conjunctivitis, so when they come in contact with another kid, they spread the disease very rapidly. Now, both men and women have about the same chance of getting conjunctivitis, and getting conjunctivitis is very common among both genders and is very common in each race. Now, what are the doctors involved with conjunctivitis? There are many doctors that can help you diagnose and treat your conjunctivitis. Your everyday doctor can help you diagnose your pink eye by asking you questions about your symptoms and can perform an examination of your eyes. Your doctor can also perform a test that drains the liquid from your eyes for your laboratory analysis. A specialized eye doctor can do pretty much the same thing, just a little more intensively. Another doctor that can help is a laboratory analyst. A laboratory analyst would be used to test the results of the liquid that your doctor drained from your eyes. A pharmacist can also help with prescribing over-the-counter drops and other various medications that you may need. Diagnosis of conjunctivitis. Conjunctivitis is very easy to diagnose. You can look at yourself and see if you have pink eye. In most cases, however, your doctor can diagnose conjunctivitis by asking you questions about the symptoms you're experiencing and by performing an examination of your eye. On rare occasions, however, your doctor may take a sample of liquid that is drained from your eye for laboratory analysis. This is only necessary when your symptoms are very severe or if your doctor suspects a high-risk cause. High-risk cause may be a foreign body, a severe infection, or sexually transmitted infection. And then there's my works cited. That's it.